Next, I will be presenting introduction. What is fibroadenoma? Fibroadenoma is a smooth, recognizable breast mass composed of fibrous and adenomatous tissue. It is a painless, unilateral benign tumor. Fibroadenoma can manifest in people aged between 15 to 35. It can also affect those of any age that already experience menstruation. So, how does fibroadenoma develop? It progresses from the lobules of the breast, in which a formation of breast mass from glandular tissue and duct happen. Thus, a smooth, discrete breast mass is seen in the breast. Statistically, various breast lump cases have been reported. A study by Satasivam stated that in Malaysia, 50% of the patients included being reported as fibroadenoma. Thus, high incidence of fibroadenoma being reported among all types of breast lump.
Now, let's see the etiology of fibroadenoma. Actually, there is still lack of research information. However, professionals believe that fibroadenoma happens due to a hormonal cycle which is related to reproductive hormone such as progesterone and estrogen. Hormonal cycles are very active during pregnancy and lactation phase. This is because the increasing of estrogen, progesterone and prolactin level lead to the breast changes. First trimester, estrogen leads the growth of blood vessel and proliferation of lobules. Other than that, increasing blood flow and infiltration of mononuclear cell. Then, second and third trimester, progesterone influence the cell proliferation of lobules. Estrogen influence ductal proliferation become much more intense. Next, late pregnancy period. Prolactin and oxytocin lead the ovarian cell to produce early breast milk called colostrum by taking up nutrients from the blood with the help of the hormone progesterone. Last, lactation phase. Decreasing of progesterone and increasing of prolactin lead to the myoepithelial cell become thinner and flatter, and expansion of lobula, then accumulation of ductal secretion. Furthermore, fibroadenoma usually grow during pregnancy but shrink during menopause due to lack of reproductive hormones.
Comparison between simple fibroadenoma and complex fibroadenoma. Comparison is made between the percentage of cases, size, growth rate, characteristic, and risk of breast cancer. The three main characteristics of complex fibroadenoma are sclerosis adenosis, epithelial calcification, and also papillary apocrine metaplasia.
Next, I will explain about cytomorphological of complex fibroadenoma. In identifying fibroadenoma, there are three main components. First is epithelial connective tissue, second is stroma fragment, and lastly is naked bipolar nuclei. The first component is epithelial connective tissue. We can identify fibroadenoma by hard cellularity, tightly packed, honeycomb sheet pattern and stacked horn-like epithelial cluster. The second component is stroma fragment. Stroma is a connective tissue that includes adipocyte, pre-adipocyte, fibroblast, blood vessel and inflammatory cells. In fibroadenoma, stroma tissue appear as metachromatic fibrillary material. Lastly is naked bipolar nuclei. Naked bipolar nuclei is an elliptical or oval nuclei without any cytoplasm. Naked bipolar nuclei also are a benign nature of the lesion.
Next is for genome-finding. The first article found out that the prevalence of coexistence of fibroadenoma with breast cancer is 0.02% in screening programs and up to 6% in symptomatic patients. Thus, histologic assessment is required for women with strong family history as they more often possess malignancy.
According to Sklailovi 2008 in Incidence and Management of Complex Fibroadenoma, fibroadenoma has a low risk of developing into a malignant and the risk has been estimated to be 0.0125 to 0.3%. Breast cancer development is 1.3 to 2.1 times more likely to occur in fibroadenoma patient.
The third article study shows that breast cancer occurs in 8.2% of 1,835 women with simple fibroadenoma and 13.3% of women with complex fibroadenoma. The risk is not influenced by the location of atypical hyperplasia, whether it is adjacent or within the fibroadenoma.
According to Hamoud 2022, ductal carcinoma in situ arising from fibroadenoma, the risk of cancer developing within a fibroadenoma is 0.02%. Patients with fibroadenoma had a 2.17 times higher risk of getting invasive breast cancer than patients without the condition.
Next is the screening and diagnosis of fibroadenoma. Screening is first done through routine physical examinations, and during these examinations, you will likely feel lumps or hard knots. And when you do breast self-examination, you should see a doctor when you notice sudden abnormal changes in your breast like the ones listed here. Next in screening is imaging studies, which is done by ultrasound or mammogram. However, mammogram is limited, and cysts and carcinomas are distinguished better from fibroadenoma by using ultrasound imaging. For the diagnosis of fibroadenoma, the most accurate way is to diagnose through tissue biopsy. It is either done by fine needle aspiration or core needle biopsy.
And last but not least, in conclusions, the chances of fibroadenoma to become cancer is very low. Concluding from several journal sources that we have studied, the chance is as low as 0.02% only. However, follow-up interventions is still recommended if fibroadenoma is detected, which is predict imaging surveillance for every 6 months for 2 years. According to Gordon et al., fibroadenoma may be safely followed with volume growth rate. If there is greater than 20% growth, biopsy should be performed. In general, fibroadenoma measuring greater than 3 cm are sent for surgical consultation. However, in cases where fibroadenoma is without epithelial abnormalities and non-symptomatic, they don't require further follow-up. With that, it concludes our whole video. Thank you for watching.